Okay, it just depends on what type of cell we're talking about and its function. Okay, so the three examples of the granulocytes, like I mentioned earlier, are the neutrophils, eosinophils, and basophils. Okay, now when we want to try to tell them apart, basically you have to look at the nucleus. Okay, you have to look at all three of them are in the same class. So you have to look at the nucleus and you have to look at the granules. Okay, first when we look at neutrophils, all granulocytes during development start out with a rather large horseshoe-shaped nucleus, and then the shape of the nucleus kind of tends to change as it goes through its maturation process. Okay, we could say a neutrophil neutrophils have a nucleus that's about 3 to 5 lobes. I'm just going to draw 4 on here. Okay, they have 3 to 5 lobes, and they're interconnected with it looks like these little kind of string-like structures here. Okay, and then again, if you look at their cytoplasm, you'll see these fine little granules all over the place after you stain them. Okay, and again, in class we use the right stain, that kind of, that purplish, whitish colored stain. All right. So that's what neutrophils are going to kind of look like under a microscope. All right. Now, neutrophils, basically the role they play, like we said, is they kind of go after bacteria. Neutrophils have a nickname, first responder cells. We call them this because in a situation like, let's say, for example, you cut your skin. Okay, you know that your skin is a physical barrier to protect you from the outside world, especially from foreign pathogens and invaders. Neutrophils are going to be the first sites there. The first cells there at the site. Okay, so neutrophils are going to go to the area, they're going to attack, and then they're going to die off, and then we have to clean them out. Okay. Now neutrophils, basically what they do is they're phagocytes. Okay, remember a cell that's a phagocyte, think of it as like cellular eating, it consumes something. Okay, and in this case, it would be a foreign entity like bacteria. So what will happen, let's say we got a little bacterium right here. What will happen is the neutrophil is going to phagocytize this bacterium, and then what's going to happen is going to create this little kind of pouch, this little that's called a phagosome. Okay, that's going to contain the bacteria. So remember, when a cell undergoes phagocytosis, all it does, it creates like a little inward fold, an invagination of its cytoplasm, engulfs whatever it is it's trying to consume, and then stores it in this little vesicle. So then what will happen is these granules then are going to fuse with this phagosome, and then they're going to dump out the digestive enzymes. Okay, they're going to dump out those lytic enzymes that'll then break down the bacteria and kill it. That's what phagocytes do. Okay, then some of them also may degranulate and then just release these lytic enzymes into the environment that they're in as well, again, to try to neutralize whatever it is they're trying to kill. Okay, and again, this can be problematic in the case of tuberculosis, which we'll talk about much later on. Okay, so that's what neutrophils do. And again, if you take a blood smear and you look at it blood under a microscope, 50 to 70% of the white blood cells you'll see when doing a count will be neutrophils. Okay, so that's the role of neutrophils. Eosinophils, they're going to have kind of a fat, almost bilobe-looking nucleus. Okay. It's not always going to look that clean. And then you're going to see the eosinophils have larger granules. Okay, they have much larger granules than the neutrophils. Okay. And again, we said eosinophils are designed to attack parasites. Okay, like worms. So again, let's say you do get infected with a worm of some sort. And now one area of the body where you do find a lot of eosinophils is in the mucosa, the mucus lining of your airways, your respiratory tract, and your GI tract of your digestive system, which kind of makes sense because the way a lot of people get infected with worms is through consuming them and eating them. Okay, so if you have a worm sitting in your GI tract, you have these eosinophils stored within the mucous membranes, the mucus lining of the GI tract, and then what they'll do is they'll migrate to the infection, and then they'll degranulate. When I say degranulate, they'll break open these granules, they'll dump out all these lytic enzymes, and these lytic enzymes then will attack the worm and kill the worm. Okay, that's pretty much what eosinophils do. And like I said, in a normal count, eosinophils should make up 1 to 4% of the total leukocyte count. Okay, so that's eosinophils. That is neutrophils, and last but not least are basophils. Okay, Basophils, your book likes to say that basophils kind of have like an S-shaped nucleus. Okay, now again, it's not always going to look that pretty. It's not going to look that much like an S shape. Okay, but basophils are easy to spot, when you actually see one because their granules are very large. Okay, they have very large granules, very large rosy colored granules. I mean, they're so densely packed in here, you can barely even see the nucleus to begin with. Okay. Now, basophils, what they do is like I said, they store within these granules. The two major chemicals that they store in the granules are histamine and heparin. Okay, histamine and heparin. Heparin is used to break up a clot, and histamine is used to promote an allergic reaction. Okay, now like I said earlier, we find a lot of these basophils in our connective tissues and also right around capillary beds. So, for example, when you are experiencing an allergic reaction, you're exposed to an allergen. That'll stimulate these basophils to degranulate. Will dump out histamine. That'll make capillaries. That'll make the pores and capillaries, okay, become larger, and then now you'll have more water exiting the capillaries and getting into the tissue spaces, which will promote inflammation. Okay, this is why if you're exposed to something that you are allergic to, that's why you have swelling and inflammation taking place because of the release of histamine. All right. Or if you get a cut in your skin, these basophils will degranulate, and then it'll make the pores in these capillaries retract, and then now neutrophils can squeeze through these capillaries, get into the tissue spaces, and then attack the bacteria that are now getting into your skin. Okay, so that's really the functional role of basophils. Now again, you can take a look at these and notice, you already know that these are white blood cells, but again, this is how you tell them apart. You look at the morphological characteristics of each. Okay. Now the agranulocytes are early in the early days when they first started staining these cells and looking at them under a microscope, they thought that agranulocytes did not have any granules at all. But later on, that was proven wrong. The granules are just very, very small in comparison to that of the granulocytes.